When a dietary trial is perceived to not work in a patient, one of the things that we have to look at is the potential that there may be some confounding factors. Those factors would include yeast infections, because yeast can mask the benefit of a dietary restriction. Doing good cytology in between the feet, in the lip margins, in the perivulvar region or preputial fossa, the area right in front of the prepuce in dogs, those are the specific areas where Malassezia, a yeast organism, can actually inhabit and actually generate quite a bit of itching to the point where it will mask the benefits of your dietary restriction. So look for yeast. Sarcoptes, which is a mite infestation, tends to hit the ear margins, the elbows, and the hocks, especially the extensor surface of the elbow and extensor surface of the hock. So if you have those three areas of involvement and a patient that's super itchy, and here's a kicker, if you happen to have the client that also has papular eruptions and they're itchy as well, that's a good indication that you probably have Sarcoptes on board. Eliminate that before you actually assess the dietary trial, because that can actually confuse the picture as well. Bacterial infections also can cause quite a bit of inflammation, probably not as much itching as yeast infections. However, some patients have what's called a bacterial hypersensitivity. So when those bacteria are recognized by the body, that can actually trigger an allergic response as well, and actually, again, mask the benefits of your dietary restriction. Okay? So those are things that veterinarians can look at. What about the owner? The owners definitely need to be careful and huddle together with the entire family, because basically it is a family effort. I can't just talk to the owner, the parent or something, and find out that, oh yeah, everything's great, we're doing a dietary restriction, and lo and behold, little Johnny is around the corner basically giving some Cheerios or some other treats and everything. Or the 2-year-old baby that's sitting in a high chair is flicking off some food for the pet, and that's actually messing up our dietary restriction. Or what about those dogs that love to do some pre-cleaning of those dishes in the dishwasher? That can also trigger an allergic reaction. When you have multiple pets in a household, that's another confounding factor, because those pets can lick each other. They lick each other's mouths and kind of groom each other. And guess what? If they're being fed 2 different diets, simply eating the food from the licking of the lips, that can actually potentially suppress your response to the dietary trial. Other areas, if you have 6 cats in a household, how easy is it to feed one cat the particular food? It's sometimes difficult unless you isolate them to a different room. If you're able to do that, fantastic. If you're not able to do that, believe it or not, it might be easier and cheaper for you to go ahead and do a dietary restriction with all the cats in the household, as long as they don't have any pre-existing medical conditions. And then that way we don't worry about a cat getting into each other's food and potentially disrupting our dietary trial for that 4-week period of time. So in a lot of cases, a lot of factors to keep in mind, even feeding things like apples and carrots. There's a condition in humans that's called oral allergy syndrome, and that's when they eat apples and carrots. For instance, during the peak of the birch tree season, those apples and carrots have the same VET-V1 protein that actually trigger birch tree allergies. Owners that use bananas to pill with, if they happen to be doing that during ragweed season, it has the same MBA1 protein that ragweed antigen has. So if the pet is not only food allergic, but is also environmentally allergic, and in particular to ragweed, simply by feeding those bananas to give that medication with, that could actually trigger an allergic reaction and mask the benefits of your dietary trial. So it really does come down to feeding one protein source, one carbohydrate source, feeding a novel protein or a hydrolyzed protein, and nothing else for a period of 4 weeks. If you can manage to do that, you'll see a 50% improvement in your food allergic patients.